ER doctors and nurses, have any of your patients surprised you with their amount, or lack, of pain tolerance? Fire medic here. Farmers seem to be tough. One time a guy pulled into the front ramp, got out of his truck and walked up holding his severed forearm in his other arm. Get him in the truck. Take off. Along the way he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911, he replied, "I just cut my arm. I ain't dying." Also had a battle of the bulge vet tell me he didn't need a blanket. It was -7 with wind chill. I was a tech in the ER when the EMTs brought in an elderly woman with what they said was a sprained ankle. She had slipped while mopping a floor at work and her co-worker had called it in. Turned out she had broken both of the bones in the lower part of her leg, but was sweetly chatting with us. I was impressed as soon as I saw those rays. EMTs had no idea and had splinted her ankle over where her bones were broken. Typically, broken bones in the legs, unless there's a huge amount of angulation displacement, do not cause a ton of pain unless moved. We see that often in the old people with hip fractures as well. They're usually sitting there still and having no pain. But the second you try to move it, they're in excruciating pain. Same goes with trying to bear weight. Not a doctor, but my goddaughter was born very prematurely, requiring a major open heart surgery at 2 weeks old. We were told by her docs that since she'd gone through so much surgical trauma the first few weeks of her life as a neonate, her pain receptors nerve endings would not develop normally. They gave us the example that if she put her hand on a hot stove as a kid, she would have sustained a severe burn before feeling any pain whatsoever. She never cried as a kid when she got shots, fell down, banged into things. Even when it was enough to draw blood, I suspect her medical history was the cause. Working in a hospital has taught me the downside of abusing painkillers. Drew Gus patients constantly come in here with long-term substance abuse issues, and now that they are actually hurt, MVC, broke bones, etc., you can give them enough Drew Gus to put down a horse and they still feel everything. That is one of my biggest fears. I had major back surgery when I was 14, so I pretty much live with constant pain. I will do everything I can to avoid taking a Vicodin so that when I get older and I really start to hurt, I haven't built up a tolerance. The only thing that sucks about it is that pills expire before I use them all, and so when I really do need them, getting a new doctor to prescribe them is really hard. They always try to treat me like a junkie trying to score. And while it is understandable, it really pisses me off. I had a patient with an open tib fib fracture, the bones in the lower leg sticking out and below that it looks like jelly, trying to walk away apparently unaware of how bad his leg was. Of course he was incredibly drunk at the time. Radiographer here. As a student I met a patient who was a typical little old lady. She came in with far too many shopping bags and walked extremely slowly. She'd been sent by her GP because she'd fallen getting out of the bath a few weeks previous. So we brought her in and took the first image, AP pelvis if you were wondering, and her pelvis was absolutely ruined. Turns out she had slipped and fallen with one leg in and one leg out of the bath and taken the whole fall on her vag. Not wanting to cause a fuss, this woman had ignored the pain and carried on her life as normal for weeks. Long enough for the fractures to be fairly healed, albeit in a strange way, not really resembling a pelvis much anymore. Not ER, but actually a cashier at a fast food place. A woman ordered 2 meals. And since she was a little older, really old actually, I offered to bring her food to the table so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape. And his right hand and part of his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they couldn't get out. He was acting like it was nothing. I was chatting with my physiotherapist one day about pain tolerance, and she said that she once had a maybe coke addict as a patient whose tolerance was absolute zero. She couldn't even touch him without him perceiving it as painful, let alone stretch or manipulate his body. She said he was a very challenging case. Edit. Fixed spelling. That sounds extremely tough for the doctor especially. Was that because of the guy's addiction? Working as an EMT. I got called a 64-year-old female slipped in her house. Possible sprained ankle. When we got there, the woman is sitting in a chair with her legs stretched out in front of her. But she had long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all. So I figured this was going to be an easy trip. I kneeled down in front of her to take a closer look. And wasn't I surprised to find that it wasn't just broken. It was ducked right up. I mean, the foot was at a 90-degree angle to the outside. And it was also leaned down, so what should have been the side of her foot was facing straight down. And the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at that moment she said, "It doesn't hurt. So I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles. Very bumpy. Come to find out she had multiple sclerosis, and that makes people feel pain differently. Not an ER nurse, but a medical technician at a couple of large events in my country. Working at a racing track. I had both of these people come in on the same day. Male. 54 years. Swedish. Small cut on hand. His reaction to me pouring water, saline, in his wound. OWOWOWOWOW. It hurts when you put disinfectant in there. Be careful. Male. 32 years. Finish. Deep cut in right forearm. His humeral bone was visible. No. It doesn't hurt. Now just tape it the duck up so I can get back on my bike. Edit. Yes. I mean the humerus when I say humeral bone. And yes, I mean the upper arm. Not a native English speaker, and also it's 1 AM. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and all they saw was me slide and hit the wall. They came over and asked if I was okay. In a normal voice I said I couldn't move my leg. No tears, screaming or anything. No one believed me, but after a minute or two I convinced them to call 911. The whole time I was waiting for ambulance, about 30 minutes, I was talking to them normally and no one believed I was actually hurt until I started going in and out of consciousness. Right as the paramedics got there I started to wake up. They got out and they didn't think anything was wrong until they cut my pants off and saw my femur was almost protruding out of my leg. I had no kneecap and tops of the tibia and fibia were protruding out. They took me to hospital. No drew guts in the ambulance, as I was joking around with them, that is. Asking if I'm allergic to anything. I told the apparently stone walls. They got me to hospital and rushed me into ER. The doctors came over and were shocked I wasn't screaming or crying. Then about an hour after the initial injury the pain finally started, and once they started moving the leg about 3 doses of morphine. Because one wasn't enough, and one of Demerol. I don't remember the next couple days besides bits and pieces. But all the nurses and doctors told me I had one of the highest pain tolerances they have seen. Although I imagine it wasn't really my choice, mostly the brain just shutting it down because I was in so much shock and had so much trauma. I've had a few patients in trids swear that their pain was 10/10 while eating, drinking, laughing, playing on cell phone. I'll chart whatever number that they said and then put in the notes. Patient laughing, insert verb or emotion. I had one nurse that when a patient would say a certain number, she'd hand them a card that would say, at a pain level of 7 you would be sweating. Vital signs would be elevated. You would be nauseated and probably vomiting. Then she'd ask, "You sure you're a 7? 9/10 would change their answers. My dad has an unusually high pain tolerance. He was cleaning a fishing pole in our backyard once when he didn't notice that the pole had splintered and pulled his hand down on it. The force caused the pole to snap in half and drive itself all the way through his hand. He stood up, walked in the kitchen with pole hanging out of his hand and calmly asked my mom if he should just pull it out or go to the ER. Since it was a fiberglass one, he opted for the ER, just in case something was broken off inside his hand. The list goes on and gets worse. The other was when he fell off a ladder and shattered his leg. The bone came through the skin and he was itchy about going to the ER. I'm a nurse who used to work in orthopedics. The amount of people who would guzzle oral morphine was unbelievable. Older adults, little old ladies, would just take 2 paracetamol and would be totally fine. I am a middle-aged guy who has worked heavy construction most of my life. I have broken everything, had 6 surgeries in the past 7 years. My daily dose of meds is 10/325 Norcoated. That is just so I can keep working with my current injury load. Anytime I end up under the care of a new DRRN, especially in the ER, I feel like a jackass trying to explain how much I take. It's embarrassing. On top of that, I have all my basic medical certs, so I know what it sounds like. Not an air doctor, but I went to the air with my younger brother after a ski accident. My brother fell on his back off quite a big drop, causing his sternum split open. A few runs later he said he was sure something was wrong with his chest, so we eventually got to the air. The doctor was shocked that he was able to continue skiing after it, and that he wasn't writhing in pain when it was touched. My brother's explanation was, yeah, it hurts, but I can't do anything about it. Edit, writing to writhing. 5-year-old child with a severed finger, half hanging off. Cool as a cucumber and not even upset. Mum was in hysterics. I have a similar story involving a 21-year-old female. Severed her index finger in a door and I was the first responder. I controlled the bleeding until we could get her to hospital, but she took it like a champ. I didn't hear a single peep out of her mouth. Med seekers and junkies coming down have the same level of pain tolerance. Barely touch the junkies and they flip out due to pain, whereas the med seekers attempt that sheet and overact. I saw a guy try to fake a seizure and it was the funniest sheet ever. He was curling his hands up like he had CP and leaning his head back to gather spit so he could foam at the mouth. Med seekers will always be allergic to morphine and need dial or didn't. I don't think I have met anyone with a high pain tolerance. Some chick came in with cysts on her ovaries and declined meds because she was in recovery. So that is actually pretty badass. Nurse here. While in school, I had a 7-year-old girl who had broke her hip by getting bounced off a trampoline. They lived a few hours out of town, and when it happened, they knew she was hurt, but not how bad. So her parents put her in the back of the truck and hauled her for 45+ minutes to their local hospital. She got there. They did x-rays and found it was way too bad for them to treat and that she needed to come to us. They rushed the family out without anything for pain for this little one. For another hour plus ride to our ER. This girl didn't shed a tear. She was hands down the toughest patient I've ever had. Had a 19-year-old do the same while skateboarding and I had to pull him out of the car while another nurse held his leg in place. Some people will amaze you with their strength and braveness. ER doctor here. My intern year in residency, I saw a 17-year-old kid who, when while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting, separating the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations. You have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked at me in the eyes and said, "Doc, just take it off." Without anything? Yeah, it's fine. They fix our cuts without numbing medicine. but it's gonna hurt a lot. I have to scrape. I know. So I went at it. He grabbed a towel with his other hand and I went to work. 45 minutes later, the nail was off. He was repaired. And I replaced the nail in its rightful place. The kid didn't even make a noise. TLDR, hockey players are ducking badders. When I was studying nursing, I saw a man who had broken his knee in a motorcycle accident 3 days before. The knee was at least 3 times its normal size. The doctor asked him about the pain and he told him it wasn't that bad. He was mostly annoyed at his family who had taken him to the emergency room. My grandmother wouldn't take pain medicine. Not sure why. But even getting dental work done, she didn't want numbing agents. The only time I know that she took pain meds was some aspirin after getting T-boned while driving and hurting her shoulder. She passed away last year from ALS a few weeks before her 80th birthday. She was the most independent person I've ever known, and even having to rely on her kids for help, she didn't complain. I broke my wrist when I was 12. After a bad bike crash, I flipped the handlebars and landed on my neck and slid a couple dozen feet. The impact shattered my helmet. Anyway, in the ER, nurses are setting up an IV in the arm that wasn't injured when I explained I landed on my neck and it was hurting. They asked where, so I instinctively used my broken wristed hand to point. Every single person in the room goes ooh and just kind stops and looked at me. And I guess I was in shock because I kinda just looked around like WTF happened. Patients in a sickle cell crisis. I've pushed up to 14 milligrams of dilaudid, 1-2 milligrams at a time, into these patients without a resulting change in vital signs or mentation. However, I've also seen young men competing in rodeos who have been stomped by a bull a few times come in with broken ribs and a pneumothorax saying, "It's just a scratch," and declining pain medications. I am a radiographer in an ER. We frequently have to move patients with broken bones to get our pictures. The elderly have a surprisingly high pain tolerance. I've seen elderly patients move limbs with obvious breaks to accommodate our needs without a peep. People with the least pain tolerance seem to be the younger crowd, ranging from 15-30. They whine and wail from the slightest touch. And more often than not, the ones with no breaks whine and scream the most. First time posting. When I was 8, I managed to squash 3 of my toes with an anvil and I kept on walking. My dad, former EMT, said that he didn't know how I was still walking around. We bandaged it up and went to my doctor's on an emergency call thing he used to do, and they took an x-ray and came in with this really weird look on his face. I shattered 8 bones and they had to do surgery to rebuild my foot. I've since been stabbed twice, in quick succession, and the admitting nurse wondered how I was concussed while nearly bleeding out. I'm an oncology nurse. My patients have some of the highest pain tolerances I have ever seen. They literally have tumors taking over entire cavities in their bodies. Huge masses pressing on places that aren't supposed to be pressed on and literally eroding through their skin, and they will ask me for pain meds when I have a second. It amazes me. Not a doctor, but my doctor seemed kind of surprised when I went back for a post-surgery appointment and told him that I had not taken any of the prescribed pain medication after getting my tonsils out. I had what I thought was a good reason at the time, though. At the pre-op appointment, he said that the pain is usually worst on the second day. Therefore, he suggested that I take a partial dose of the painkillers on the first day, then take the full dose on the second day, and use as prescribed until I recover. For some reason, I decided that it was a better idea to not take anything at all on the first day, and just wait to take the painkillers when the pain got unbearable. I kept waiting for it to get worse, and eventually it got better. Oops.